Hi, I'm Nicole Birch, a genetic counselor at the Community Health Clinic. Today we're going to be covering the concept of a founder mutation. Our DNA is our entire genetic library. It is made up of a series of letters or base pairs, A, T, C, and G, that repeat billions and billions of times in a particular order to make us who we are. Our DNA is divided into different sections called genes, which are then also made up of these base pairs. Variations, also called mutations, in the spelling or sequence of these base pairs or letters is what gives rise to particular genetic conditions. A founder mutation is a particular variation or mutation in a gene that causes a genetic condition and is seen at a much higher frequency in a specific population of people compared to the frequency of that variation in the general or overall population. Populations with founder mutations usually share certain characteristics, such as being smaller in size and being set apart in some way, either geographically, like living on an island or only living in a particular region of a country, and possibly through cultural practices or norms. These characteristics lead to there being less genetic diversity and less genetic variation flowing in and out of a population. A founder mutation exists then because the mutation was present in one of the founding members of that population, and that member passed it on to his or her children, who passed it on to their children, and so on and so forth, such that that particular variation is seen at a really high frequency and contained usually within that specific population of people. It's important to note that this doesn't mean that that genetic condition caused by the founder mutation is only seen in that population. It just means that the mutation that causes that condition is really not seen outside of that population, or that there aren't other variations or mutations in the same gene that cause that condition. For example, in the plain community, when we diagnose somebody with a genetic condition and then we run a genetic test to either help with the diagnosis or confirm the diagnosis, we usually see the same mutation over and over again as the cause of the condition. And the multiple patients we have aren't necessarily, closely related to each other either. But that's the founder mutation coming into effect. It's the same variation causing the same disease in a population over and over again. Versus in a larger, more genetically diverse population, you might still see that condition sometimes, but the cause of it could be a whole different mutation or 5 different ones that we'd have to kind of come up with each time. We wouldn't really know off the top of our head which spelling variation or mutation it's going to be as the cause of a condition. Knowing about founder mutations is really helpful when we're evaluating a patient for a possible genetic condition because it can clue us into the likelihood of a patient having a particular condition. So when we see a patient at the community health clinic and we think that patient has a genetic condition, we come up with a list of possibilities or our differential. And if a patient's signs or symptoms seem to overlap with a particular condition and we know there's a founder mutation, that condition might move up on our list of possibilities or our differential. And then we might pursue testing for that one because of the knowledge of a founder mutation versus another condition without a founder mutation. Knowing about founder mutations might also change our genetic testing strategy. If we suspect a patient has a particular genetic condition and we know, say they're in the plain community and there's a founder mutation for that condition, instead of ordering genetic testing that sequences or reads all of the thousands of letters that make up the gene, we might just order targeted testing that goes right to the spot of the founder mutation, and it's kind of a strict yes or no answer. Is that mutation there or is it not? That type of testing, that targeted testing, is really cheap and really fast. We get results back in a day or two. Overall, knowing about founder mutations can be very helpful in our care and evaluation of patients at the CHC. And hopefully this video helped you learn a little bit more about them.